facilitator and I will be doing the pre-briefing. The simulation takes place in the emergency department. My patient, Mrs. Alina Khan, 32 years old, is presenting with pleuritic chest pain, joint pain and mild respiratory distress. She is fatigued and you'll notice signs suggestive of systemic lupus erythematosus, including a facial rash and mouth ulcers. Additionally, there will be a family member present who is agitated and may interrupt or challenge you throughout the scenario. The objectives of today's simulation are as follows. First, to perform a comprehensive history and clinical examination of the patient. Second, to work together in diagnosing and managing an autoimmune condition like SLE and its complications. Third, to manage effective communication both within the team and with the patient's family who may become challenging during the scenario. Any questions? No. Okay, let's remember to apply core ethical principles. Number 1, respect for the patient and the attendant no matter what. 2, non-maleficence. Ensure our actions don't cause harm. 3, justice. Provide fair care. And autonomy. Involve the patient in making the decision. I am Dr. Ariba and I will be focusing on obtaining the patient's history, particularly regarding the chest pain, joint pain and any systemic symptoms such as rashes and fatigue. I'll also guide the patient through their current symptoms to ensure we don't miss any relevant details.
So, I am Dr. Rabia. I will examine the patient thoroughly, particularly focusing on signs of pleural involvement, arthritis and rashes. I will also assess in interpreting the patient's history to guide our differential diagnosis.
I'm Dr. Santosh. I will focus on monitoring the vital signs, arranging the diagnostic tests, and managing any immediate clinical interventions that the patient needs. And also ensure that we stay on track with orders like chest x-rays, ECGs, and the blood tests.
We'll have 20 minutes for this scenario. This is a safe learning environment, so don't worry about making mistakes. We'll debrief afterwards and discuss how things went. Let's begin.
Nurse, I don't know, it keeps beeping this week. My patient is suddenly stopped responding. Do something. Can't you call the doctors here? We have patient doctor. Please come down. Please hurry up. Is she gonna be okay? You'll be alright. Nurse, it's been so long. You've called them. Why aren't they here? What's happening here? Finally, you're here, doctor. It's been so long. I understand, dear. We're all here to save the life of our patient. I'm Dr. Ariba, this is Dr. Rabia, and this is Dr. Santosh, and we're all here to save her life. Please do something. Yes, dear. Please calm down. Hello, Mrs. Khan. Can you hear me? Properly. Okay, Mrs. Khan, can you tell me what's bringing you here in the hospital today?
Doctor, my chest is hurting and joint pain.
Okay, I understand that you're having multiple issues, but let's begin with the chest pain. When did it start?
It has been a few days.
Okay,
And it's worse when I take deep breaths.
okay, it's worse when you take deep breaths. Have you had anything like this before?
Yes, months ago.
Okay,
Doctors told me it was something like pleurisy.
okay, are you saying pleurisy? Is this what you're saying?
Yes, that word.
Okay.
And Mrs. Alina, and the joint pain you have been experiencing, when did that start? Do you notice any specific joints being affected?
Doctor, wrist and knees, they have been aching for weeks. And they're swollen so much.
Okay, Mrs. Khan, can you please tell me, have you had anything else like rashes or mouth sores?
There's this rash on the cheek.
Okay, here.
And it has been there for a few weeks.
And anything
And my
else?
there's sores in my mouth.
Mrs. Khan, have you been feeling more tired than usual? Any fevers, weight loss, or other symptoms?
The thing is, I'm exhausted all the time. And I've lost weight. But no fevers.
Alright. Anything else, Mrs. Khan? Do you want to say anything else?
I can't remember. Not that.
Doctor, rashes, sores, what are you talking about here? Why don't you look at the picture?
Ma'am, please calm
Here,
down.
problem here, she's
Everything we
not
are doing
breathing
is for the
properly.
patient, so we could get a good picture.
I don't know what you guys are asking irrelevant questions.
No, we are asking the relevant stuff, sir. Please calm down. We'll do whatever
I
is
don't
possible.
know what you.
We will do. Just trust us.
Okay, Mrs. Khan, we will perform a quick clinical examination. We will look for your lungs and your joints pain and any other signs that might help us in making your diagnosis. Dr. Santosh, please perform the vitals.
Nurse, could you please read out the vitals loudly?
Her oxygen saturation is 85%.
Okay.
Her blood pressure is 140 by 90.
Okay.
And her pulse is 110 beats per minute.
Okay.
And
What's the temperature?
temperature, she has a mild fever of 100.5.
Okay. And what's the respiratory rate?
Respiratory rate is 16.
16.
So
That's
on
okay, that's
observation, may I proceed with the clinical
Yes, sure, sure, sure.
examination? So on observation, the patient is in mild respiratory distress and she is breathing via nasal cannula. So I'll perform respiratory examination first. On inspection, there is no chest deformity, but she is in mild labored breathing. I will start with palpation also. We need to perform complete exposure, but due to privacy concerns, we are not exposing the patient. Mrs. Khan, are you facing any difficulty? Are you feeling pain?
Please let us know.
Yes, my chest hurts.
Okay. So there is tenderness on the right lower field. We need to percuss. Okay, so there is a stony dull kind of percussion on the right lower field. We need
Please
to auscultate the patient
anterior side.
from the anterior side.
Please take deep breaths, Mrs. Khan.
Mrs. Khan, take deep breaths. I also need to check the patient from posterior side.
Yeah.
Please pretend it.
We are gentle, Mrs. Khan.
Thank you, Mrs. Khan. On auscultation, there is decreased labored breathing, might be indicative of pleural effusion.
Okay. I'll check the joints.
Okay.
Is it hurting you?
Is it hurting you, Mrs. Khan?
Yes, yes.
Okay, don't worry. You'll be alright.
Ah,
Is it hurting?
Is it hurting, Mrs. Khan?
yes, very much.
Okay.
It will be done in
Gentle,
further
gentle.
time.
It's done.
Okay, I will also proceed for her skin examination. So there is a butterfly kind of a cheek rash on her face, and also there are non-painful sores on the inner lip. So please note that.
You can put a torch and see also.
Okay.
Okay.
Yeah. The sores are present on the inner lip.
That's
Right.
okay.
Okay.
Thank you, Mrs. Khan,
Thank
for
you,
the
Mrs.
examination.
So summarizing the findings, we'll get back to you later.
Could you please tell me the positive findings?
She is in fatigue.
Okay.
She is having shortness of breath,
Okay.
and she has joint pain. She has butterfly rash on her face, malar rash, and she has swollen joints and mouth ulcers on the inner lip.
I noticed that there was also restricted movements of the joint.
Yes, and the breathing also was very depressed. So doctors, we have performed history and clinical examination. Based on these physical examination and the biodata we have got written here, what are your differential diagnoses?
So seeing the constellation of symptoms and the history, SLE, systemic lupus erythematosus is my first PD.
Okay.
Okay, so next we can put the rheumatoid arthritis.
Okay.
Okay.
So also the patient is female and she is young, she is having joint pain, so we can
Yeah.
keep rheumatoid arthritis on her second option.
Okay.
What next?
We can also keep pneumonia because of the lung findings that
Very
we got.
slightly,
Yes.
yes, because of having respiratory distress.
And she was having mild fever, so we can keep it in the differential.
Okay.
diagnosis.
Any
Next-
other
Yeah,
difference?
next we can, I think we can put pericarditis. because-
Pericarditis.
Yeah, there
I
was
think so, yes.
frictional rub on the chest examination.
Also, she is having pain on deep inspiration,
Mm.
so we can
We can
keep
put
pericarditis.
pericarditis.
Were you
Also,
able
if we are
to-
considering SLE, so it could be a complication.
Complicated. Dr. Santosh, were you able to listen the friction rub?
Yeah,
Or
I
the
was.
nurse, I think she told me that she was hearing the friction.
Yes.
I heard it.
Even
myself.
I did the respiratory examination, so I.
So Dr. Rabia, what investigations are we supposing to do?
So we will perform chest X-ray, ECG, CBC,
All the baseline?
all the baselines for anemia, thrombocytopenia, and for
the
SLE,
SLE, I think we should go for ANA.
ANA,
Okay, anti-double stranded DNA.
We should
Okay.
also
And then we can
proceed
perform
first.
for complements level as well.
complement levels.
Initially, we should do the inflammatory markers.
Yeah, CRP and ESR.
Yes,
we can,
and
Okay. CBC, chest X-ray,
yeah. ECG,
ECG,
blood workup,
blood workup,
and then we'll go for ANA.
ANA.
Please mention what blood workup because it will be confusing for the lab.
No,
Okay, so we have to perform complement levels
Yeah,
And inflammatory
and then the
markers.
inflammatory markers, CRP and
and
ESR.
inflammatory markers.
Okay. And then for the confirmation, we will be gonna do anti-double stranded DNA,
Okay.
and then anti-Smith antibodies.
Double-stranded DNA
Yeah,
and
anti-Smith antibodies.
Smith antibodies. What else? Do we need to perform any for lupus nephritis if we can consider?
Yeah, we can do RFT as well.
Renal function test.
Yeah.
But initially, we should also do a urine DR.
Urine
Yeah,
DR.
we can do
Okay.
On the baseline.
So I'll order the nurse for the labs.
Okay.
That's fine.
Okay. Perfect.
Thank you.
Doctor, the labs are in.
Okay. Let me take a look. So the doctors, the labs are ready. Okay. So on CBC there is mild anemia.
Alright.
There is thrombocytopenia. WBC counts are elevated.
Elevated or declined?
It's elevated. On the chest X-ray there is pleural effusion. Okay, and on the ECG she has got sinus tachycardia. The complements level C3 and C4, those are declined. Okay, inflammatory markers CRP and ESR are raised. Okay, and she is positive for ENA, which is most likely suspecting some
Okay,
autoimmune
so you are
condition.
thinking in the right
Yeah.
direction.
Okay, and we have anti-double stranded DNA and anti-Smith antibodies. They are positive,
They are
Oh,
positive.
so it's
this
most
is,
likely.
and her RFT level they are also deranged.
RFTs are also deranged.
So
likely
maybe she's like going for nephritis as well.
lupus nephritis.
Yeah.
Okay.
So
We have come to the conclusion of systemic lupus.
I think we should
erythematosus.
inform the patient and the family
Yeah,
about
yeah.
the case.
Okay.
Hello. I hope you are better now. Okay, so after all the relevant history, clinical examination, and when all the reports have come, we've concluded that Mrs. Khan might be having an autoimmune condition. It is called systemic lupus erythematosus, and this is the reason she is having this chest pain, joint pain, and this malar rash.
So when will she be cured or what is this disease?
ma'am, we have concluded it's SLE, so we are soon starting our treatment. You don't worry, she'll be alright.
Thank you, doctor.
Thank you.
Thank you everyone for participating in the simulation. Now we are going to reflect on the case, focusing on what went well, what challenges we faced, and what we can learn for the future. Remember, this is a safe place to share thoughts. There is no right or wrong answer here. We will look at this from three main perspectives: clinical decisions, teamwork, and communication with the patient and attendant. Before we dive into the details, I would like to start by asking everyone how everyone felt during the simulation of suspected case with systemic lupus erythematosus.
I think I felt a little overwhelmed at first due to the pressure from the attendant, and I thought that it was challenging managing the patient's distress and the communication within the family.
I agree. Balancing between taking actions for the patient's urgent need and managing the interruptions from the attendant was challenging. But I think we stayed professional.
Yes. And yes, for me it was about staying focused on the patient's comfort and to ensure that all the tests were done and executed properly. Yes, it's natural to feel pressure in such situations, especially with an agitated patient, but we did a good job maintaining professionalism. Let's discuss the clinical decisions we made during the scenario. Our first step was history taking. How do you feel we handled getting the patient's history?
Okay, I think covered all key points related to the chest pain and the joint symptoms and the relevant systemic review, including the rashes, mouth ulcers, and fatigue. We tried to get as much information as we could get from the patient and the attendant.
Okay, great. Is there anything we could have improved in our scenario?
Perhaps we could have asked more about her medication history, especially regarding any drugs that might affect her immune system, especially like corticosteroids.
Okay, and any other drug that can induce lupus? Like
Procainamide, hydrolizine, and isoniazid, these can also be
good point. A detailed medication history is essential, especially in chronic conditions like SLE where immunosuppressants might play a role. Okay, now then we performed clinical examination. We identified key findings such as pleuritic chest pain, swollen joints, and malar rash. Any point you would like to add?
The pleural effusion, that wasn't easy to detect without imaging, but the decreased breath sounds that helped guide us.
Also, managing the patient's comfort during the exam was crucial as she was already fatigued and in respiratory stress.
I think we did a great job by dividing the responsibilities, and each of us looked the case at a different aspect, and the nurse played a vital role in managing and comfort care.
I agree, though maybe we could have streamlined the communication a bit more to avoid overlapping tasks.
Okay, that's a good observation. Clear communication about who is doing what can always help, but overall I think we work well together. Now focus on the learning points. So what are our main takeaways from today's simulation? Let's start with the medical side. What did we learn about diagnosing and managing suspected SLE?
We learned to focus on systemic symptoms in autoimmune diseases like the joint pain, pleurisy, and the skin involvement. It's also essential to run the tests like ANA, anti-double stranded DNA, and the complement levels.
Yes, and from a communication perspective, we need to stay calm under pressure, especially with difficult family members. We need to remain empathetic but firm.
I also learned the importance of patients' comfort and keeping them informed while we are running tests and making decisions. Excellent points. To sum up, we did well, gathering a history, conducting focused examination, maintaining teamwork under pressure. But the next time, we can improve by refining our communication and taking an even more detailed medication history. Overall, this was a great learning experience. Thank you all for your contributions today. Before we finish, does anyone have any final thoughts on how this scenario can improve in our real-life practice?
Definitely, I feel more confident in approaching a complex autoimmune case like systemic lupus erythematosus, especially with a team-based approach.
Exactly, the simulation emphasized the importance of staying calm and methodical, even when the situation feels chaotic.
And from my side, I'm reminded of how critical it is to support both the patient and the medical team in times of high stress situations. Yes. Thank you again, everyone. Let's take what we have learned today and apply it in our future practice.
Thank you.